Right, I just want to introduce myself. My name is Mark. I'm one of the new instructors here. I may have seen y'all on the hallway as I run back and forth like a chicken with my head cut off. Today we're going to talk about doing an intradermal injection. Have y'all got to do any of these in clinical so far? Okay.
No.
The main reason that we do an intradermal injection is when we do a PPD or a TB skin test. That's actually what we're going to practice with today. It's like we're actually using TB syringes here. Some facilities, they don't have TB syringes, so you have to use an insulin syringe. They just sort of have consolidated their stock just so that they'll have, they can use like different syringes for different things. But here in the classroom, we're in the perfect world, so we're going to have insulin and TB syringes. And when you take NCLEX, you'll also have if you have a choice between a TB and an insulin syringe, you want to always make sure you pick the TB syringe for any type of non-insulin injections. When you give a TB skin test, you'll probably use a multi-dose vial. These vials, are usually stored in like an AccuDose or some central access where you can get them when you need them. If you have one that's already got the plastic cover top, you want to do it just exactly like you would clean an IV hub side. You want to clean it for 15 seconds, and you'll let it air dry. Now sometimes you'll get a brand new vial. It'll have the plastic top on it, and you'll pop the top off. I think some students have been taught that that's sterile and they don't have to clean it. To me, I just try to clean everything just to get into a good habit of doing that. So it's like I said, 15 seconds, let it air dry, because some of these multi-dose vials may have been in my pocket, they may have fallen on the floor, they may have actually fallen in the floor. It's like when the person's in the bathroom, so you can just imagine what kind of cooties they would pick up there. So what we've done is, this is all nice and clean. We're going to grab our TB syringe and we're going to pull back to 0.1, because that's the normal dose that we give when we do a PPD skin test. And with regards to this, you just do it exactly like you did before. And I'm shaking, I'm sorry. And you're going to push the air in there, and you're going to draw back. Now sometimes you'll have little tiny air bubbles in there. Those air bubbles are really hard to get out by tapping. And you'll say, I have one hand on the vial and one hand on the syringe. In order for you to tap, you've almost got to take one hand off of the vial, and sort of sits up there and rocks back and forth. The reason that sort of bothers me a little bit is these needles are really small needles, and these vials can be so heavy that they can actually fall off, and as they fall, they'll bend the needle when they come off. So I always like to hold it one with one hand and one the other. And if you see any small air bubbles in there, I just go back and forth. And you can do that when you drop insulin too, and that way you don't have to start tapping, because some of the air bubbles, it's almost impossible to get out, but it's like if you go back and forth a couple times, you'll get the majority of the air out. So we want to pull back to 0.1, because that's the dose that we're going to give. Pull it out. Okay, now the only time that we recap needles is a needle that has not been into a patient. Okay, and then what we teach here is we teach the scoop method, and you just try to scoop the cap up. Now don't put your finger there and push the cap on, because sometimes it's like you may use a different cap than the one that came with a needle, or the needle might actually be longer, and you're using this cap. If you put it there, when you're pushing it back on, you can actually push it. If it's a different cap, you may actually push the needle completely through this plastic cap, and it'll poke you right in the finger. So when you scoop, grab it by the sides and put it on. Because what we don't want to do is we don't want to drop our medicine in the med room and then go down the hallway with an uncapped needle. Okay. So once we get in our patient's room, we're going to introduce ourselves. We're going to wash our hands. If they're use the foam stuff when we come to the patient's room. Like, hey, my name is Mark. I'm going to be giving you your TB skin test for today. Now, one of the places that we always do, or we try to choose if we have a choice, we usually put it in this area here because it's easy to see, and we can observe it without taking the patients down on. We can also put it in the upper chest and the upper back, but just like I said, most of the time we'll just do it in the patient's arm. Now this area is really tender, so I always try to warn the patient this is probably going to be really tender, but it'll just hurt just a second, and the needle's not going in very far at all. Now when you clean the patient's arm, I know you've been taught to do it obviously in a circular fashion. Some of the teaching today is to do a really good hard scrub. So I actually try to do both of them, because some patients are sort of they don't have good hygiene, they're not really clean, and sometimes just doing a circular motion will not scrub it enough to get all the dead skin and all the bacteria off. So usually do it, take 2 or 3 alcohol preps. You can use as many as you want, it really doesn't matter. And then the first thing I do is I just scrub really hard, because they say that the scrubbing sensation or the scrubbing motion actually kills most of the bacteria. And then when you get ready to do, when it's mostly clean, you'll just sort of do your circular motions. So it's like, you actually are able to do 2 things at one time, and we're pretty sure that area is completely clean, okay? Always let it dry, just because whenever you try to stick to alcohol, sometimes it can burn. Okay, and we put our bevel up, and if you're blind like me, it's sort of hard to see bevel up. Now, what you want to do is you want to hold the skin taut, because what happens is if you don't hold the patient's skin whenever you go in, the skin is going to move away from you. So, and then there's several ways that you can hold it taut. You can hold it taut like that, or like that, whichever you prefer. And you're probably going to use the method that's best for you. Okay. What I like to do it just like this right here, just because because in case I'm nervous and I'm shaking. Sometimes if I can put my hands on the patient's arm and hold the arm still, I can make my hand be still. And then I'm probably going to be nervous here too, because the patient's going to be saying, "You better not hurt me," and all that other kind of stuff. So what we're going to do is we're going to go in at about a 5 or 10 degree angle, bevel up, and see if I use my thumb to hold the patient's skin taut and to stabilize my syringe, there's not a lot of movement going on. So I can be just as nervous as I want to be. Okay. So what we're going to do is we're going to go at a 5 to 10 degree angle. Push your medicine in. And you're going to see the bevel or the wheel, or some people call it a bleb. You're going to see it pop up there. That's exactly what you want to see. And you'll see some patients, when you take the needle out, it'll bleed a little bit, and you can just sort of gently rub it, just to get any blood off. Some patients will want a Band-Aid. We try to discourage any type of Band-Aids or anything, just because it can irritate the skin. So we don't want to do anything that's going to make it look like it's a positive TB skin test already. So what we're going to do is once we pull the needle out, we don't want to recap this one because it's been in the patient's body. We put our little safety up. Okay. Questions? And you just document on your MAR. Of course, all of our MARs are all computer controlled nowadays, so so it's like we'll scan the vial, scan the patient, just to make sure we have the right patient.